100 years ago, most Americans largely paid their own way where medical expenses were concerned. Medicine was local, doctors made home visits, and it was relatively inexpensive. By the 1930s, the Great Depression was overwhelming Americans, and discretionary money for healthcare was literally drying up. That's when companies started forming private health insurance cooperatives, allowing individuals to buy insurance to help cover healthcare costs. These were some of the first group health insurance plans. The topic of government-sponsored healthcare was being discussed in the 30s. In fact, in 1932, President Roosevelt pursued government healthcare, but it was generally unpopular at the time. In fact, some of the biggest opposition came from the American Medical Association. President Roosevelt was trying to also pass the Social Security Act, and he eventually dropped universal healthcare from his platform in order to make sure that Social Security was passed. Fast forward to the 40s, and the world was facing severe inflationary pressure in large part due to the proliferation of government spending to support the war effort in World War II. And just like today, inflation is a huge threat to the economy. As a result, the 1942 Stabilization Act was passed to help stabilize the economy. Rising wages for workers can contribute to inflation, so the Stabilization Act instituted wage and price controls to manage the economy. Not surprisingly, workers pushed back and threatened to strike. In response, the War Labor Board exempted employer-paid health benefits from wage controls and income tax. The result? Workers didn't have to pay income tax or payroll tax on their benefits, and employers also received a 100% tax deduction on the value of the benefits provided to employees. Health insurance suddenly became the crown jewel of employee benefits. By the 1950s, employer-sponsored health insurance was mainstream. Fast forward to today, and over half of Americans have health insurance from employer-sponsored plans, and the workplace is the primary source of benefits for employees. Over time, government programs have been introduced to help cover Americans not eligible for employer-sponsored health insurance plans. Medicaid and Medicare followed in the 60s to cover retirees and underserved citizens, and various healthcare reform acts have since taken place, such as the Health Security Act in 1992 and, of course, the Affordable Care Act in 2010. So that's how we got to where we are today. So until next time, be well.